We'll get you more about her in the days going forward. Now let me tell you about Tamil Nadu, which has emerged as a big new epicenter of the coronavirus in South India, with cases and deaths rising with each passing day. Here's our report on what's happening in this state. Akshaya Nath gets you the latest.
Tamil Nadu is India's new COVID epicenter, reporting maximum daily cases. 14.89% rise in daily cases has been seen in the last 1 week. The state, on an average, has witnessed over 354 deaths in the last 1 week. The medical infrastructure is in doldrums. On the 20th of May, 72% of ICU beds and oxygen beds had been occupied. The Tamil Nadu COVID war room is facing a crisis.
We do a surge capacity planning. Every collector is on a surge capacity plan, and collectors are really planning for because we are 2 weeks behind many other states. So our planning is based on our projections, and the projections we try to estimate the number of beds required, and we try to add it incrementally.
The government has instructed private medical colleges to set aside 50% of their bed capacity for COVID-19. However, setting up additional ICUs for the growing demand is a major challenge.
The repeated calls are more. Like, people want to know what is the update in every 15 minutes or 30 minutes. We understand their grievances and we are responding for it. And the volume of call is getting filtered to 2,000. And again, if you go back whoever wants the ICU, it is almost only 500.
Availability of oxygen is also a concern. Tamil Nadu's daily demand is over 500 metric tons.
We have our own production, but it's really hand to mouth. Government of India has actually allowed us under the Oxygen Plus 519 metric tons. Similarly, we are looking at oxygen audit, utilization of oxygen by the hospitals, and wherever on a daily basis, again the Unified Command Center collects the data, gives us.
The second wave has seen an increase in the number of healthcare professionals getting infected. 89 doctors have lost their lives to the pandemic till date. Vaccination is also among the lowest in the country. Images of misery that were seen during the height of second wave in other parts of the country are now being seen in Tamil Nadu. Long queues outside crematoriums reported from Coimbatore district.
Every day we have been visiting crematoriums and ensuring that there is no wait time. In this regard, two things we have done. One, we are almost finishing the CCTV camera installation in all the crematoriums and burial grounds. Have a direct watch at us. Secondly, we are also going to make online availability of crematoriums.
At this juncture, we are seeing that the opposition parties are alleging that improper lockdown which has been implemented in the state is one of the reasons why the number of COVID-19 cases are still rising. The opposition party has demanded that stringent measures be put into place to ensure that there's a cap on the increase in number of cases. Well, we're seeing that the state government has been working hard to increase the number of beds and to increase oxygen availability. But what will it do to ensure that the COVID-19 numbers are brought down? That is a big question. With camera person Daniel from Chennai, this is Akshaya Nath for India Today.